So good morning. Thank you for joining us today. My name is Ellen Woods, and I'm the Program Director for Senior Services at Phelps Hospital and the co-chair of the Livable Communities Caregiver Collaborative. Jerry Brooks, Vice President, Integrated Healthcare at the Ambassador of Scarsdale, also co-chair of the collaborative, along with Colette Phipps, LMSW and CDP, Director of Program Development at Westchester County Department of Senior Programs and Services, are pleased to be able to jointly present this program with the Senior Law Day Collaborative. The Senior Law Day Collaborative is composed of more than 150 professionals who bring authoritative information on legal, financial, and health topics to Westchester County's older adults. With us today, representing the collaborative, are Bruce Siegel, consultant, Senior Law Day Collaborative, and Sarah Steckler, Esquire, partner at Warshaw Burstein, LLP, who is also one of our speakers today. Joining Sarah is Cornelia Schimert, RN, BSN, from the Care Connections program at Phelps Hospital, Northwell Health. The title of today's program is on Organizing Your Successful Aging Plan, a fresh approach to elder law and meeting the challenges of caregiving. The program offers a fresh perspective on developing a customized plan for your future. Before we start, just a few housekeeping items. The program is being recorded and will be made available on two websites, the seniorlawday.info and careprepwestchester.org. I'll put them in the chat so that you can refer to them later. Participants in this webinar are muted, and you can ask questions via the question and answer box on the bottom of your Zoom window. Please keep the questions in the general nature. Questions will be answered at the end of the presentations. So once again, on behalf of the Livable Community Caregiver Collaborative and the Senior Law Day Collaborative, I welcome you to the program. Cornelia Schimert will open our program. Cornelia?
Thank you for that introduction, Ellen. It's a pleasure to be here to talk about the Care Connections program and more specifically, care navigation. I come to this from being a care navigator, working with Phelps Hospital and Westchester County Department of Senior Programs. Care navigation and the Care Connections program is a combination of care navigation, caregiver education, caregiver resources, and providing care baskets to caregivers in Westchester County. We work with any caregiver that either lives in Westchester County or where their family member, or who we call them care recipients, if they live in Westchester County. It's a program that's funded through a grant that comes from the New York State Office for the Aging to Westchester County, and it supports caregivers at a very critical time in our history, so to speak. The funds, so all the services that are available through our Care Connections program and the care navigation are provided through at no charge to the caregiver through the grant. So that's a wonderful thing. And the other, I think, wonderful thing is that we consider every caregiver and every family situation as unique. As you know, many times, especially since the pandemic, it's been very difficult to even get a person on the phone. Well, in our, through the care navigation program, it's the opposite. We talk to you, we can provide a Zoom meeting with you, we can help you understand more about what's available throughout the county and even in the region with regards to caregiving resources. And we provide you with unhurried time, sometimes one session, sometimes multiple sessions over time, so that your needs are carefully considered and thought about. And we listen very carefully to what you think your priority concerns are. What we found is that caregivers are perhaps one of the most neglected segments of our society, because the caregiver has an enormous burden to deal with when they're caring for a spouse, maybe a sister or a brother who is elderly, or a parent. There are large, significant financial, social, emotional, and physical strains that are put on the caregiver. And I would add, there are spiritual stressors as well in this caregiving process. The caregiving can last for a long period of time, with many ups and downs, with many changes, with crises. Many caregivers that I speak to have been caregiving for years, and oftentimes they're looking at a period of years ahead of them. So it's not something that's a once and done, or let's look at the caregiving situation that is occurring right now, but it involves planning for the future and anticipating what might happen. What I think is often a concern for caregivers, and we have taken care of several hundred caregivers over the past year. This program started in February and March of last year. We've met with well over 100 caregivers in care navigation. In addition, we've met caregivers and their family members with the other services that are part of the Care Connections program. Most caregivers, their situation has been made more difficult as a result of the pandemic. So they have lost access to important services that have kept their loved ones socially active. For example, the social adult day programs that many families have relied on. It's been very difficult to get an aid. The managed long-term care organizations have been overwhelmed. All of the providers for the caregivers of resources have many more clients than they can handle. So I would say that care navigation can help point you in the right direction of what you need to do. What we try to do in the care navigation process is look at your priority concerns and then put together a plan for you with step 1, step 2, step 3. This is perhaps a possible direction, or these are several options that you might consider, and let us help you look at these options and then follow up with you to see what was the follow-up that you made and how does it work. The most critical area for many caregivers is, what is their stress level? How are they impacted on by their caregiving situation? How are things working in the family? Are there family members that could be a support to you that we can help you talk to and share your concerns with, and maybe come up with some possible decisions or options that you could all agree on as a family? So we look at not only the caregiver, but their siblings or their children. How can they be brought into the process? Because no caregiver can handle the process of caregiving all by themselves. And many caregivers feel that they should be able to do it all. And we know that's not possible. And many caregivers feel they want to make it perfect. They want to do the best they can for their loved one. And unfortunately, this is not a perfect world, and the resources are not always perfect. So there are many challenges that come up. So I want to say, what's most important about the Care Navigation program is that this is a partnership between Westchester County Department of Senior Programs and Phelps Hospital, that we together have many connections with care providers throughout the county. And we try to bring those connections and those resources that we have together through this partnership to benefit the caregiver in our county. So I just want to go over and let me know when my time is up, but there are so many issues that I have found that have been brought to care navigation. And one thing that I feel is very helpful is that in the caregiver care navigation program, we have a nurse and a social worker, and the backup of some of the services at Phelps Hospital that we can kind of go back to and say, okay, what do you think? How can we help this particular family? Oftentimes people come to, and I just want to go through some of the common caregiver issues that are brought to the care navigation program. One is that the care recipient or the family member that a caregiver is caring for lives alone or with their spouse, and they need more assistance. Maybe there's been a sudden change or a gradual change, but how can they go about getting the care that they are now realizing they really need? So maybe they've not needed it before, but now they need it. What we help them sort through is, what are you eligible for? What are different types of care that are available? Where can you access this care? Are there grants or special resources that might be available that could help you pay for the care? Is a Medicaid application in order if you haven't already gone down that route to help you pay for care now or in the future? So we kind of walk you through all these different options of, maybe you're already connected to a managed long-term care organization, and they're not as effective as you would like in getting you an aid. How can you best advocate for yourself? So sometimes I get calls from people who have an aid, and a lot of the resources are in place, but they don't really know how to work with the aid. Sometimes they need coaching on what should an aid do, what shouldn't they do, what can you expect from them. Maybe the aid that you have is not the right match for your care, the person that you're caring for. So it's kind of, we drill down to what is challenging for you in your situation, and we figure out what are ways in which you can handle the situation or move forward or make it better. So, in some ways, we're very detail oriented, because as they say, the devil is in the details. We have to get it so that it works for you. One question that often comes up, and that I know my colleague Sarah Steckler will talk about, is how will the care be paid for? A lot of times people are not aware, of resources that are available even through the county, through the ISEPS program, or other grants that might be available. Or how could I pay for, I need respite for myself so I can go on vacation, and where can a family member go to get total care while I'm away so I have peace of mind? So it's kind of figuring out what resources, what are the next steps that you need to take to ensure that there are resources for your loved one's care. That's not always easy. Oftentimes it helps if you have kind of done the pre-planning, but we have to start where you are. Some people call because they haven't, when we talk to them, as they say, you don't know what you don't know. So sometimes people will call with a problem, and we'll ask them questions. We do like a comprehensive assessment. We'll ask, do you have emergency plan? There are people caring for their loved one where they're the only person that is really able to make decisions for them and assure that they are safe. Well, what happens if something happens to the caregiver? What might an emergency plan look like? We'll take the time. Sometimes it's an hour, it's 2 hours, it's multiple sessions to help you put that emergency plan together. Sometimes people call and they're revisiting their advanced directives, which is something you should do every year at least. We'll talk through, well, what are the different issues? An advanced directive that you did several years ago may not be the advanced directive that you need right now, because things change. The person's condition changes. Sometimes people call because the care recipient has a chronic medical condition which is changing. We want to help you look at, well, what resources are available for somebody who has Alzheimer's disease or dementia or some kind of dementia diagnosis. Are you connected to the Alzheimer's Association or to Pathways to Care at WJCS? So we kind of look at your understanding of what is involved with that illness. And that's where sometimes talking to a nurse can be very helpful, because since I'm a nurse, I can say, well, I can anticipate, I can understand the symptoms that your loved one is experiencing and what might help. Sometimes there's a mismatch between the medical services that they're receiving and what the care recipient really needs. So we might be looking at, well, if you have an internist who is retiring, maybe now you need a geriatrician. What kind of, where might you find that geriatrician? Is it at the Phelps Senior Health Program, or is it at WestMed, or where is it? Just recently, I met with a woman and her sister. The mother's doctor was not able to deal with her depression. So we looked at, well, would a geriatrician be possible? Where could you find that person? It turns out that one of the client's, the care recipient's daughters was in a practice with a very well-known geriatrician. So it took just one phone call for the daughter to call the practice and say, I'd like to get an appointment for my mother with that geriatrician. Problem solved. The mother is going to see the geriatrician even today. So that's an example of what care navigation can help you kind of think about. Well, maybe a geriatrician would be better when someone is 92 years old. Maybe before an internist had the skills that maybe were appropriate, but now you need to pivot. Sometimes I have people where the person can no longer get out to see their doctor. Well, where might you obtain a physician that makes home visits? So these are all the kind of questions about medical related concerns. Sometimes we get a call that their loved one is in a facility. Okay, it might be a hospital, it might be assisted living, it might be in a nursing home. The family member or the caregiver has questions about how the care is being managed. What should be done? Just this week, I had a care navigation meeting with someone where they said, oh no, my family member is going to the hospital. So the care navigation involved talking to the caregiver about what is happening with the person as they're in this kind of medical crisis, and what kind of services to access within the hospital. In this case, to access a palliative care consultation to help sort out issues of should we resuscitate or not. So the person did get that palliative care consultation. So that would be the outcome of the work that we do in care navigation. Sometimes a person maybe with dementia is in a rehab facility or in a nursing home, and they're being overly medicated to handle behavioral symptoms. Sometimes I help the family member sort out how can they best advocate in this situation. Sometimes it may be calling the ombudsman program to get an outside advocate to kind of advocate and support the caregiver. Sometimes people call us because the home situation, the home you're in where you're living, it no longer fits the situation. So we're looking at somebody that needs to move out of their apartment or their home to another level of care. Is it an assisted living facility? Is it a nursing home? Maybe looking at what kind of facilities are right for would be maybe suitable, would fit your budget or fit the type of diagnosis that the person has, or providing greater medical supervision. So we help guide the families for the options that might move them in the right direction. Recently, I had a meeting with two siblings, a brother and a sister. The mother has dementia and lives in an apartment by herself. She can no longer live alone. So we looked at a number of different assisted living facilities with memory care units, and they decided on one that fit their budget. They made a decision together on a Zoom call with with the Care Navigator. So we can help move a family to better understanding the situation, better understanding what's out there, what resources might fit, and then making a decision.
Cornelia, I just wanted
Yeah.
to jump in and say, you want to think about 3 or 4 more minutes, and then I'll.
Okay, thank you. Yeah, because I could go on for hours.
Yeah,
so
we all can go on.
yeah, I know everybody can do that. But finally, I just want to talk about caregiver stress is probably universal. What's beautiful about Care Navigation is that we can talk to you in private, unhurried, with no judgment, and really no pressure in any way. And that is invaluable. Caregivers, I had a caregiver say to me, I am physically, emotionally, and spiritually depleted. Now that is rock bottom, I would say. I speak to that caregiver every week for a while to help her maybe feel a little less depleted so she can make some decisions about her care. Some caregivers are dealing with ambiguous grief. Every step of the way, they are losing part of someone they love. That someone has not died, but many aspects of who they were have changed or have been lost. It's important for the caregiver to get support in working through this ambiguous grief. Maybe it's joining a support group. Maybe it's having a counselor. Maybe it's talking to the caregiver for a number of sessions to kind of work through this. At any rate, we can provide a safe space for caregivers and figure out how can they take more care of themselves, because like they say on the airplane, put oxygen on yourself first before you put it on the person or the child that you're with. I think that's so true. There has to be a balance, that you can't keep giving out as a caregiver and not taking care of yourself. So sometimes we'll recommend a whole range of resources. We'll send you a report sometimes by email. You might have a long list of recommendations, and you pick the one that is most important to you. For example, I had a gentleman who was taking care of his elderly brother, and we figured out that the brother who was the care recipient was very bored, and I recommended someone to come into the house to help think about activities that would be appropriate for someone with dementia. In another situation, I helped the brother develop a list of questions that he would bring to the care recipient's medical provider, so that he could better understand what stage of his illness the person was in. I think that I think that people that are caregivers are giving their loved one a wonderful gift. It is very important that the caregiver reaches out and gets the help they need through a wide variety of resources. I would suggest that people put the number of the Care Navigation program on their refrigerator, just like poison control or the fire department or the police department or the ambulance. Put our number on your refrigerator, and when you feel that you need some advice, you need some individualized guidance, then call the Care Navigation program. And our number is 914-366-1199. Leave a message with your name and number, and we'll call you back. And thank you for the time you've given us.
Yeah, that was really amazing food for thought. Anyone can really benefit that. I just wanted to interject with a couple of kind of more qualification questions, and then we'll move on to Sarah and we'll address additional questions at the end. I think you've alluded to this, but it sounds like the Care Connections program, not all the services, but the Connections program is really for anyone in Westchester County, regardless of your income. So I just someone wanted to confirm that.
Absolutely. So there's no specific eligibility requirements, regardless of income. There is no charge. It is totally confidential, and it is customized to you. So if you're a caregiver who has a family member that lives in Westchester, we can't provide care navigation or any of the other services.
Great.
Sometimes the care recipient lives in Westchester and the caregiver lives out of Westchester. That's okay too, as long as there's a connection to a caregiver or a care recipient in Westchester, you are eligible for the program, and that's it.
Okay, so let me just clarify. There was another question. Suppose the caregiver lives in Westchester, but the patient or the person who's being cared for lives in Putnam County. Is that okay?
I don't know, maybe Ellen could weigh in on that. I believe that is okay.
Okay, great. Okay, so with that, I'm going to put, there's another question, but I want to make sure, we get time for Sarah. So we're going to, and we invite more questions via the Q&A, as Ellen said, but I'm going to turn it over now to Sarah to give us the legal perspective on all of this.
Thank you.
Thank you, Corinna. Good morning, everybody. Thank you so much for coming to our program this morning. And the Senior Law Day Collaborative is part of the Public-Private Partnership for Aging Services, just like the Caregiver Collaborative is. And our services are also free, and we don't ask what your income or assets are, to go on our website and to enter a question on our Ask Us button, and to have a professional in the discipline in which you're looking to get a question answered from, to call you back or to send you an email and to get in touch. So please use us as well as an educational resource, in addition to the Care Navigation Program and the other resources for Westchester County, which are all free. So I'm going to talk about really getting ready for care. So really creating your own table of contents to your life. So when someone needs care, so when someone is in the middle of getting care, that you have your life story in a binder, that you've gotten it down on paper, so that you can speak with an attorney, an accountant, a doctor, a nurse, a care navigator, really any sort of professional that may be providing services to you and your loved ones. And getting it all done on paper really is a big job. And creating your financial table of contents means going through lots of different categories that make up really your financial life. So going through, getting down on paper, your insurance policies, life insurance, health insurance, car insurance, home insurance. Life is complicated. So making copies of those policies, making copies of those cards, and then putting that all together in a folder, in a binder, however you would like to organize yourself, so the information is there front and center when you do need to have a care management conversation. Because when you need care and other services and you have to get the paperwork together first, it is very much overwhelming. Other things that you should put in your financial table of contents, and if you don't have a pen, that's okay. We're going to be posting my financial table of contents on the Senior Law Day website with the video after the program. The next category are bank accounts, putting down, the name of the bank and maybe the last 4 digits of the account number on a piece of paper, checking, savings, money markets, CDs. If you have debit cards, credit cards. If you have a credit card, the expiration number, maybe you'll make a Xerox of it, put it in your book where you're keeping all your important information, really the guide to your financial life, as well as login and password information for online accounts. And it's on paper, maybe in a binder, maybe you're putting it in a notebook, maybe you're putting that notebook in a fireproof box in your house, stapling copies into it. However best you would like to organize yourself so the information is there. Other important categories to pull together are mortgages or loans. Do you have a mortgage on your home or a loan agreement? Has that mortgage been paid off? Have you made sure that your bank has filed a satisfaction with Westchester County or the county you're living in with land records to make sure that obligation has been taken care of? Then we go to everyone's favorite category, taxes. Making sure that you have your accountant's information if you're using an accountant or other tax preparer, making sure that you have copies of at least the most recent income tax return that you filed. And if you may be relying on Medicaid in the future for your long-term care insurance, the past 5 years of income tax returns in a safe place where someone in your life knows where they are. Also, another category of information to pull together, and I know it's a lot of categories that make up our financial lives, are pension plans and retirement benefits, whatever might be in your picture from the time you were working or what you may have inherited from a loved one. You also need to put together titles to anything you may own that actually has a title, like real estate for a deed, or if you own a car, your title and registration, or if you have leased a car, the lease documents, so that someone in your picture is able to find those documents. If you live in a co-op, knowing where your original stock and proprietary lease is and letting someone else in your life know where you have stored those important documents. We also want to log in your index, in your table of contents, if you have any investment accounts, if it's a managed account, or if you have loose stock like with ComputerShare, so that someone knows where your stocks, your bonds are, if you have paper savings bonds, if you have mutual funds or other non-traditional investments. We want to make sure that they're all in your plan, all in that document for the person in your life who's going to be helpful with that. Then, after you've collected all of that financial information, we need to talk about what your estate plan looks like. Because if you don't have an estate plan, New York State has a plan for you under the New York State intestacy statute. So if you want to have a say in who gets your assets when you pass away, other than what New York State says, spouse and kid, then you would want to make sure that you have a will, that you have a trust, that you have some sort of vehicle that expresses your wishes legally, so that your property, when you're no longer here, ends up where you want it to end up. So if you already have a will, you would want to make sure to include a copy of it in your plan and where the original will is located. Often, if the will was done by an attorney, the name and the address of the law firm would be on the back, which is generally blue on a copy and cream on the original, as well as copies of prior wills, and maybe the business card if you used a professional for that individual who created that document for you. And the same thing goes if you have a bit more complicated estate plan and you've created a trust. You would want to make sure to have copies of the trust agreements and any amendments, the name of the attorney or law firm who prepared the document for you, and as well as a list of assets that are owned by the trust. And that's really important because I've seen a lot of people create trust-based plans and then they don't move their assets into the trust and they don't realize that they're not done yet. So when you have a trust-based plan, there's 2 steps. The first is to actually create and sign the trust, but the second step is to fund the trust and actually retitle the financial accounts or real estate or whatever you're putting into that bucket to make sure that the trust actually owns the asset. Other documents, rounding out those important list of what everybody should have, really as soon as they turn 18, is a power of attorney, and an original and a copy of the power of attorney should be part of your guide, as well as a list of your financial accounts. So that person you appointed the power of attorney as your agent, that person who steps into your shoes and can do everything you can do in terms of your financial life, knows where the accounts are, especially in case if they need to pay bills, if they need to do work under that document. You also need to, if you have a safe deposit box, that person should know where the box is, or should know where the keys are kept. And as you continue on life's journey, you may want to also consider having someone else own the box and have you be the signatory. So if you were to unexpectedly pass away, that box isn't frozen, especially if it contains something important like a will, which is best kept in a fireproof box at home rather than in a bank vault. where it's not accessible, or if you pass away, then you need a court order to unfreeze that box to search it, and that's quite the process. So, safe deposit box planning is a really important little piece that some people often overlook. Another category of that index, that binder of your financial life, are your professional team. And it's important to think of who are those key players on your team. And often they're your physicians, however many you may be seeing, your general practitioner, maybe your neurologist, your cardiologist, your dentist, whomever you're seeing. So your healthcare proxy, your power of attorney, they know who you've been seeing, especially if you're on multiple medications, so they can check up to make sure there's no drug interactions. You also want to have down if you work with an attorney, if you work with an accountant, an insurance agent, a care manager or a care navigator, and a benefits coordinator if you're on Medicaid, or if you're getting Section 8, or if you're getting veterans benefits. Anyone who's in charge of your government benefits or has helped you to apply or is coordinating your case is an important contact. If you're getting home care, the manager of the home care company, if there's questions, someone who's your case manager. If you're in a skilled nursing facility, often the social worker or someone else in the facility who can answer questions, especially if something pops up and care really needs to be coordinated. Like when a patient is going from a skilled nursing facility to a hospital, and then maybe back to rehab, and then maybe back to a skilled nursing facility, to make sure that care remains coordinated and that you're asking questions and that you're getting answers to those questions. And often when someone is in that continuity of that continuum of care, there are a lot of questions, and we want to make sure that they are getting answered. And that's really one of the terrific benefits of the care navigation program, is if you have questions and you feel like they're not getting answered, you can give them a call and they'll help you to advocate, they'll help you to get it down on paper and help you to communicate, so you feel good about the care and that it's not like listening to a foreign language regarding your loved one. There also are private hire geriatric care managers who can serve the same role, but those are a paid service that your family would privately engage. So rounding out that list are advanced directives, and there are many of them. Often people have a healthcare proxy, which appoints an agent who can make decisions regarding your care if you cannot make them yourself. People often also have a companion document, a living will. And a living will is a document that has your instructions regarding end-of-life care. It's a private family document. It's really instructions or even a permission slip to your healthcare proxy to say that if there's no hope of recovery, it's my time, let me go. I want to die a natural death without further intervention and pain medication where possible, and that my wishes be honored. And that's a place to get down those specific wishes. Also, some people have specific funerary wishes and complete a disposition of remains form, which is really important if you want someone other than your spouse, to make those sorts of decisions for you. Also, sometimes people pre-plan a funeral and get a pre-need agreement, but the disposition of remains form with that is an important companion. So the person who you've appointed is in charge of those wishes, because just because you've prepaid for your funeral doesn't mean that those instructions would be followed if your legal next of kin has something different in mind. And then also a MOLST form, which is medical orders for life-sustaining treatment. Yes, that's a mouthful. It's often on Pulsar pink paper, and that's a really important document for individuals who are terminally ill or have some sort of long-term illness, because the document is supposed to follow you from home, wherever home might be, to the hospital, and then to a skilled nursing facility or rehab if needed. And it has decisions like do not resuscitate, no CPR, do not intubate, which means no breathing tube. It has decisions regarding antibiotics, medication, whether you want them or whether you don't. And a social worker, case manager at a hospital can help facilitate that conversation to having a physician prepare the document. So on that list of advanced directives, that is the one form that your attorney or legal professional cannot prepare. That form has to be prepared by a medical doctor. Other important documents to have in that binder, to navigate your care so that everything is in one place if care is needed, are proof of identity. And that's something that's easy to pull together. Things like Social Security cards, birth certificates, military discharge papers for veterans, marriage certificates, death certificates for spouse, parent, or children, divorce decrees, prenuptial agreements, separation agreements. All of those things are part of your book as well. And for those little cards, like your Social Security card, your Medicare card, you can Xerox them all together on one sheet of paper, put it in your binder, and you have them there. One part of your plan, which people often don't think about and they go on autopilot on, are really your monthly expenses, so your household bills. It's important to have those there too, so that if you need care, we can prepare a budget for it. We know what your assets are, we know what your income is, and we know what you're spending per month without care. That way we can see how much is available to either pay for care, or if there's a deficit and there isn't enough to pay for the care that's needed, that you can look at applying for Medicaid, because care is something that is often rationed, and it shouldn't be, because everyone should be entitled to the care they need so they can live fulfilling and safe lives, whatever that person's idea of care is and where that care is being provided. So to put together things like your electric bill, gas and oil, water, telephone, internet cable, property taxes, credit card bills, especially if you're paying for things like groceries and clothing and whatnot on a credit card. So knowing what your bottom line is with running your household is also very important. Another section of your book is medications. Names of your medications, names of the pharmacy where your prescriptions are ordered, names of the doctor who prescribed the medication. That helps someone who's coming in to manage your care, or if you go into the hospital, to know what you're taking, how much, when, and where you're ordering the medication from. That way you can have a continuance of medication. If you have an emergency situation, you end up in the hospital knows what medications you're on, and they can also track for medication interactions, which sometimes happens when you have multiple physicians. And the last category, even though some people would have other categories, are your digital footprints. And I know that's something that's different to think about, but at this point, most people, especially those who have joined us online, have email addresses. You may have social media accounts with passwords, Facebook, LinkedIn, Twitter, TikTok, whatever you might use. You might have online accounts where you order goods and services like Amazon, or you might have Instacart, or you might be a seller on eBay. Those sorts of accounts are important to put in your book too, so your loved ones know what they are. As well as, online banking and digital assets, which have been in the news quite a bit. So as this class of assets developed, if you own it, your agents should know where it is and where it's located. And of course, other people have, other pieces to their digital footprint and their financial life. And whatever those pieces are, they should be part of your book and part of that table of contents, so that someone coming in can see where everything is, what's going on in your life. And if it needs to be tweaked and to be reorganized, it can be, so care can be obtained or paid for. And I know that's a lot. It's incredibly overwhelming, especially if you don't love doing paperwork, but everyone should have that, guide to their life, so someone coming in could navigate and help them find the right care solution for what they need. And if you find paperwork overwhelming, you can talk to a care navigator, break it down into pieces. You can talk to your attorney, you could talk to your accountant, you could talk to one of us at the Senior Logic Collaborative for a free 15-minute one-on-one consultation, and we can help you pull it all together, or even just give you some housekeeping tips so it's not quite so overwhelming, because there's a lot to think about. Also, I see some questions coming in. Oh my goodness, there's a lot of questions that came in.
There's also some in the chat, Sarah. I can
Yeah,
that when you're done.
yeah, quite a bit. So I'm going to pause and take some questions. So
Okay.
one question is, when is a trust needed in addition to will? Everyone's estate planning situation is different. Everyone owns different assets, and some people are comfortable with just a will. Some people are more comfortable with a trust. Some global reasons for using a trust as the main estate planning vehicle are either if it's an irrevocable trust, asset protection with the goal of applying for Medicaid either now or down the road, or if you're using a revocable trust where you're still the captain of your own ship, all the assets are under your Social Security, is really just to avoid probate. And why might someone want to avoid probate? Well, maybe they're a snowbird and they own a home in New York and they own a home in Florida. Maybe they're in a second marriage and they have a blended family, and maybe someone isn't rowing in the same direction and might not sign a waiver and consent so easily to probate. Maybe someone just wants that extra layer of privacy because wills become public documents once they're filed. There's no right or wrong reason to do a will versus a trust. Sometimes people do a trust because they want ease of administration for the family. They don't want assets, to be frozen, but they can't just rely on beneficiary designations because either they're not tax efficient or it doesn't cover everything in their picture. There is no typical cost for a trust. Every attorney or law firm, bills differently. So, when thinking about the vehicle that would be helpful in terms of your personal plan, you might want to talk to, 2 attorneys. I wouldn't talk to more than 3 because that becomes overwhelming at that point, getting so many points of view. And just ask questions, and you can see what fits in your budget and, what feels comfortable for your family. When looking for an attorney, you often want to feel that, personality match, just like you would, when picking any other professional. And of course, fees are an important piece of that puzzle for most people. So another question is a list of items to include in your binder in your table of contents available online? The answer is yes, it will be after the program. Bruce just put our website into the chat, which is seniorlawday.info. And that list will be posted under the video for the program. So yes, we will be providing that online.
Sarah, there was a follow-up question on the wills and the trust in the chat. If you don't own a home outright, so you still have a mortgage, can you put it in the trust?
The answer is most likely you can put your home in a trust. With a mortgage, we would want to just make sure that what we're doing is not going to trigger a due on sale clause. But often with a traditional mortgage and a revocable trust, the answer is yes, because you're still owning the asset, you're not giving it away. And with an irrevocable trust, most can also be put into a home with a mortgage into that trust. We just want to make sure that the terms are not harmful before taking that step. There are certain kinds of more complicated tax planning trusts where you do have to pay off your mortgage, before putting it into a tax planning vehicle.
That sounds a little bit like what you said earlier. Could be a little overwhelming. So I'm going to kind of let that one just go. And on that note, actually, I wanted to invite Cornelia back on the screen. If you put there you go. Just sort of take the focus off of Sarah so you can see Cornelia a little bit better. And Cornelia, there were a couple questions I think were for you. One, is there an advocacy group in New York or Westchester which is working on the death with dignity, compassionate choices law? I think that's for you, but Sarah, feel free to jump in on that one.
Yeah, I don't think that I want to comment on that one. I think there are groups in the regional area that are working on that.
Okay.
Maybe Sarah has more insight into those. I mean, I'm familiar with them, but
Yeah, just sort of outside of our scope here.
exactly.
So then the other one, is a little more specific. I don't know if there's a fireproof home box source. So I'm not sure what that even is, but it looks like
it's basically like a little home safe, which really
home
isn't
safe,
meant, yeah, which can be picked up and moved. It's really just if there was a fire that, it's fireproof. And I'm sure Consumer Reports has an article on, what brands they recommend, but they can really be purchased from most places, like from Amazon, Home Depot, Walmart. There are many big retailers that sell fireproof boxes. You just will have to, poke around and see what fits your price point.
We do. We still have a few more minutes. So I wanted to invite more questions via the Q&A at the bottom of your screen. So Cornelia and Sarah are still available, and so let's give people a moment, to see if there's something else. In the meantime, I think I've caught everything. I guess Sarah, what I was wondering, and I wasn't sure, the sort of online versus, I guess it's the same list that you should have, in paper in your home where someone can find it, and online. It's not really a difference, right?
No, people can have that list on their computer. They can have that list as a binder, but some of the information I was talking about is sensitive, like social security cards,
Right.
bank
Right.
numbers.
That's true.
So having that hard copy is a way to really store without having to worry about data security and privacy and safety online. But if you do have questions about that, we have a great program done by the Westchester County Attorney General's office on how to stay safe online on our website, which is a terrific resource as well.
All right. Well, we certainly have a lot of questions. Didn't take folks long. And one is really more of a comment where I think that they felt it was important that allergies, particularly to medicines, be important to include in this document. And I'm sure you would agree, Cornelia. I don't know if you have anything to add on that. Okay, it's just not. And
I think the more information that you can put together about your, maybe you need another medical binder, or make sure that you can find your medical information in your portal, and even think about, did you sign up for the state health exchange, so that if you're in upstate New York and you have an emergency and you need to go to the hospital up there could access your records at, say, Caremount or WestMed or wherever, so that kind of the medical aspects of your situation maybe warrant another binder, like getting reports, printing out the reports that, come from your colonoscopy or from your workup or from your annual visit. And, really thinking about the questions, what is known and what questions do you have, and getting your priority questions answered. And that's, again, a good reason to kind of work with the Care Navigator to see, well, what do I know and what don't I know? And the Care Navigator might say, well, you might consider these other questions. Like, oftentimes people really don't have the information at their fingertips, and they can't really answer some of the questions that I might ask them about their medical condition.
Great.
Their loved one's medical condition. So that's a whole other workbook, I would say.
Another question for you, Cornelia. Is there a group that provides advice on affordable housing or senior housing? I guess that could be for Sarah as well. So either of you, feel free to jump in on that.
There are, Westchester County Department of Senior Programs and Services provides assistance to people that are looking for affordable housing resources. There are various groups that we would refer you to that also provide housing counseling, that, do Section 8 applications. So there are resources for that. Unfortunately, the housing itself is more difficult to access. And there are waiting lists for Section 8 housing. So, you know, if that is a need, we would refer you to the people, especially in the Department of Senior Programs and Services, that deal with housing.
And we just put the telephone number for the Housing Collaborative into the chat. So if you were the question asker regarding housing, please check out the chat, write down the phone number, and give Westchester County Housing Collaborative a call.
Mm-hmm.
Okay, great. The next couple of questions are for Sarah. Someone wanted to know if they could have a revocable and an irrevocable trust at the same time.
Yes, there are estate plans that have multiple pieces. And yes, you can have a revocable trust and an irrevocable trust at the same time. But we would just want to take a look at holistically your whole plan to make sure that what you've prepared is interacting with, you know, your assets and the pieces properly, so it's doing its job. And just like you get an annual checkup, hopefully, you're also doing at least an annual checkup of your finances, of your estate plan, to make sure that you understand the pieces, that the pieces are working together, that your assets are properly titled, that you have proper beneficiary designations, so that, you know, when you do have a crisis, that part, you know, doesn't need to be looked after first.
Mm-hmm.
Then we had a question: what do you do if you live in Queens, New York? What you know, what comparable organizations, either to the Caregiver Collaborative or to the Senior Law Day Collaborative? Anyone know of anything in particular? Any place to point somebody?
Well, the Senior Law Day Collaborative is a unique place in New York State in terms of counties. And, you know, if you live in Queens, put your question in our Ask Us button anyway, and we're still happy to answer your question. And, you know, Westchester Library System also has, you know, a lot of terrific resources, and they're not going to say, don't check us out if you live in the 5 boroughs.
Yeah, the key thing that I say to people about the collaborative is that the information is generally, correct me if I'm, you know, Sarah, it's generally valid in the state of New York. And so that's kind of my guideline. If you live in New York, the information will be consistent with some minor differences. But if you live a Connecticut resident or a New Jersey resident, I just kind of have to say, you know, time out. I want to be careful, you know, with how you take,
Right.
you know, some of this.
Well put.
Yeah, I'd just like to comment on that. You know, I think what we would do in care navigation, and which I often do in my Alzheimer's support groups, is help the person figure out, well, who do they know in their respective community? Because you could live in Queens, you could live in Long Island. You have to kind of figure out where you can find out about those resources. So we would point you in, not only might we do research ourselves to find out what's in your community, but also help you kind of navigate what you know about in your community. So it's kind of like peeling away the layers of the onion. Well, who have you found helpful? Have you been in a hospital? Can you call the case management department? Can you, what is the Office for the Aging? If you're dealing with the Alzheimer's disease of a relative, maybe calling the local chapter in your county to find out about more resources. Westchester is that fortunate to be able to kind of access these resources quite easily. In other areas, though, it's the same process. You just kind of go from one person to the next and then assemble your resources. And that's kind of like Sarah was talking about the book, Getting Ready for Care. In a way, you try to get ready for the care that you'll need in the area that your family member lives in. And by calling everyone that you possibly can find out about. And eventually you have your book of resources for when you'll need it.
Great. We have one more question in the Q&A for Sarah. How often should POAs and wills be reviewed? Well, I think you addressed that. Is that once a year? Do you have any other comments on that, Sarah?
Well, when life circumstances change, or generally when you get a call from a client saying that, you know, my spouse is sick, I have a new grandchild, I'm moving to another state, I'm thinking of buying another home, And that's often when a touch happens with the attorney, but just not from necessarily reaching out to your professional, but just on a personal level to review everything in your picture really on an annual basis. So you are familiar with it, you feel comfortable with it. Maybe you forgot why you set up an irrevocable life insurance trust, 20 years ago. And is it, is the life insurance still in place? How is that policy going to interact with your estate plan when, the tax exemptions have gone up so much in that period of time? And you may have questions. And it's really important, to address the questions so you feel comfortable being the captain of your ship and knowing what your whole picture looks like.
Right.
Well said. Okay, I guess we have just really quickly, we do have 2 more questions, and then I think we'll have to then direct people to seniorlaw.info. Someone had questions about Yonkers having different resources than other communities.
I would say there are various different communities may have resources that are specific to their community. And that is something that, maybe Yonkers resources could be accessed outside of Yonkers or not. I'm not sure about that, but that is something to be aware of, and maybe there are specific organizations, faith communities have resources that might be helpful in one way or another. So yes, senior centers sometimes have a wealth of services for someone who is a senior citizen. So it's keep a very open mind to where you might find what you need.
We have a last question on research studies. I think what we're going to do is I'm going to now show the information for the 2 presenters, and you're more than welcome to contact them. Particularly on that one, probably Cornelia would be a good person to contact. And then someone was asking where Sarah works, and we love it if she was full-time with the Senior Law Day Collaborative, but she's not. Here's her contact information. You can reach her at Warshaw Burstein. Here's the email address, the phone number, and of course you can always reach her on LinkedIn if you're on LinkedIn. So, and then Cornelia and the Care Connections program, excuse me, can be reached here, and she welcomes they welcome any inquiries. So with that, just a thank you. I thought that we've got a lot of compliments in the chat. I hope the rest of you found this useful as well. And with that, what I'm going to do, I'm just again going to thank everybody. Thank Colette for doing that little introduction from far away.
Thank you, everyone, for coming today. And I would like everyone to think about elder law as not just the preparation of legal documents, but getting your, the book of your life together so that, when you need care, you can get the care that you need without rationing it.
I love that. I love that analogy, Sarah.
I just want to say on behalf of the Livable Communities Caregiver Collaborative, thank you for coming today, and the partnership that Phelps Hospital has with the Department of Senior Programs and Services and the Westchester County Public-Private Partnership allows us to bring you this program and allows us to be able to give you these services. And as Cornelia had said, there's care navigation, there's care baskets, there's education classes, and there's in a needs-based situation, some financial assistance. But it is grant funded. So, we will be having to ask some, specific questions, but everybody is basically eligible as long as either the caregiver or the care receiver is connected to Westchester County. But I'd like to thank you and just say on behalf of the Caregiver Collaborative, if there's anything we can do for you, we'd be happy to do so, and we'll have more programs throughout the year. Thank you for the collaboration with Senior Law Day Collaborative as well.
Yeah, well, on both those excellent summaries from Ellen and from Sarah, I think I'm going to end the webinar and thank you for joining us again today, and feel free to reach out with any further questions. So have a great day.